So Lily is a 6-month-old child who was accompanied to today's appointment by her mother, Mia. Previous records indicate that Lily has bilateral atresia, resulting in a conductive hearing loss bilaterally. Lily's mother has expressed concerns and fears regarding the impact of developmental delay and not meeting developmental milestones due to Lily's hearing loss. Lily's mother is motivated to seek treatment for her amplification and rehabilitation needs. There were no other remarkable findings in the child's medical history. Hi, Lily and Mia. It's nice to see you again. So the goal of today's appointment is to discuss next steps and treatment options available for Lily. Before we get started, do you have any questions?
Thank you again for meeting with us today. I'm very interested to hear about treatment options available for Lily.
Yes, absolutely. So to start, I just kind of want to review what was found at the previous appointment, and I'm going to use this diagram of the ear to further explain findings. So an auditory brainstem response testing was done via bone conduction at the last appointment, and what was found was a bilateral conductive hearing loss. So what that means is that the problem lies within the outer or middle ear. As medical records indicate that Lily has atresia, meaning she doesn't have an ear canal on either of her ears, resulting in the fact that traditional amplification using hearing aids isn't an option. So what we're going to discuss today is a non-surgical option known as a bone conduction hearing device.
I've never heard of this before. Does it require surgery?
So no, it is a non-surgical option. Due to Lily's age, we're going to choose something less invasive to start out with. This leads to my recommendation of the bone-anchored hearing aid on a soft band. This device is simply worn around the head like a headband, and then there's a small little black box that Lily will wear on the bone right behind her ear.
Does Lily meet the criteria for this device?
Yes, so due to Lily's age, degree of hearing loss, and type of hearing loss, this is an appropriate device for her.
How will Lily do with this device? Will she be able to hear me?
Yes, so with the bone-anchored device, it allows Lily to have access to speech and sound. Basically, Lily will hear, the bone device bypasses the normal way of hearing, and she'll hear through her bone.
How many hours a day should Lily wear the device? I hear that the headband will hurt after a while.
So for Lily, especially due to her age and us wanting her to continue to meet developmental milestones, we want Lily to wear her device at all waking hours of the day. The makers of the device were aware of comfort was a part of the decision-making process when making the device, and that the headband is a soft band. We want Lily to wear the headband where it's tight, and the fact that that little black box will stay on that bone behind her ear, but also taking into consideration that we don't want it to be too tight that she could get a headache or become irritated by it. So ultimately, we like to be able to still fit like 2 fingers underneath the band.
Is this device covered by insurance?
So that will definitely be a conversation to have with the insurance company that you use directly. But due to the age of Lily and the severity of the hearing loss, oftentimes insurance companies cover the device for pediatric patients.
What's our next steps?
So the next step is I would like to actually get that device activated today and get that set up. So I'm going to grab my laptop and make some adjustments here. Okay. All right, so now that that device is programmed, I would like to see Lily back in about a month, just for us to discuss progress and to address any concerns that you may be having with the device. Ultimately, your job is to just continue to be diligent and intentional with exposing Lily to language. So that can be like modeling language and behavior and just providing Lily a really language-rich environment to learn in.
I can do that, absolutely. A follow-up question, As I've already started looking towards the future, is this the device that Lily will wear forever? I fear that as she gets older, she will not want to wear this as it's not super cute or attractive.
Yes. So I completely understand where you're coming from and your concern. As Lily gets older, we will start to consider a more surgical option, meaning that we'll have a surgery that includes like an implant into the bone, and then she'll wear an outside piece as well.
Gotcha. What will this procedure look like?
So the procedure altogether takes several hours to complete, just with pre-op and then post-operative testing that takes place, and it's done under general anesthesia as well.
I understand. Just curious, when the time comes, how long will the recovery take?
So that depends on, that's very like patient specific, and typically patients heal fairly soon. It is an outpatient surgery, so she'll be able to leave the office that day.
Thank you so much for addressing my concerns and answering all of my questions. I look forward to seeing you again in a month.
Yes, you as well. And I'm going to give you my business card in case you have any questions in the meantime, and I'll see you in a month.
Thank you.
Thank you.